Okay, here we are, part 4. More exercise concepts, kind of getting down to the nitty-gritty of it. Contraindications. This is very general. I mean, you can do exercises with these things, but you have to be kind of more cautious, I guess, around them. Um, Multiple sclerosis, Guillain-Barré, especially if it's very hot, where you're working in a gym or something, a clinic. Be very careful around exercises with them because it can make everything worse. It can really exacerbate their symptoms. Rheumatoid arthritis. Be very careful with rheumatoid arthritis, especially if the joint's in an inflammatory stage, because you can do a lot of damage, permanent damage to a joint, the cartilage, if you're giving them heavy resistive exercises. Spasticity, we talked a little about this. This is kind of your tight muscles after a brain insult, brain injury, a stroke. Quick aggressive stretches can make everything too tight and really imbalance everything. Anytime the patient is compensating. So, for example, you ask them to lift up a weight into shoulder flexion and they start twisting and turning awkwardly, it's too much. You got to back down, get rid of the weight or whatever. Don't want to push it with the compensating. It leads to all kinds of bad things. Pain, I mean, there are some cases where it's good to kind of push through the pain, but in general, somebody's in pain, we don't want to make them in pain. Cardiac symptoms, especially overhead. So like above shoulder, right here, her left arm is above shoulder. If she had cardiac issues, that would be kind of dicey. You have to be really, really careful about that. And then you're getting all kinds of restrictions from the doctor. And usually they're going to tell you, no resistive exercise or whatever it is that they're going to say. It tells you you can't do exercises yet. How much is too much? These are kind of general guidelines. What do you want to do? Do you want to build up their endurance, or do you want to build up their strength? Let's say she's having a hard time getting up, pushing up out of that chair, and she has very weak triceps. If you're trying to build up the bulk of the triceps, think high load, less reps, less frequency, kind of increasing that load. Let's say it's the opposite. She just gets general fatigue when she tries to do any kind of activity, kind of lower load, higher reps kind of thing, watching that form. So that, again, they're not compensating, increasing slowly, hold up over duration, and combat fatigue. How much exercise is okay for older adults? It's kind of based on research. You can do 5 days a week. Generally speaking, this is a good guideline if you're trying to figure, what's a good place to start with this person. Should increase their heart rate no more than 50 to 70% while they're doing the exercise. 30 minutes is kind of a good kind of limit, little general guideline. You can break it down into smaller chunks. Maybe start with less and kind of build up to 30 minutes. But 30 minutes a day, 5 days a week is pretty good. There's some guiding principles around how OTs use exercise. Try to make it fun. It's like an acronym. Fun, try to make it as functional as possible, address those underlying components, the range, the muscles and the joint motion you're trying to get at. And never forget to make it purposeful and meaningful as much as you can. And then make it part of their daily routine. What do I mean by that, daily routine? I want you to do this exercise every time you sit down to watch the news at night. I want you to do this exercise every time you stand up at the dishes to wash your dishes. I want you to do so many arm, shoulder flexions or whatever. So it's part of the routine, working in the routine. It's a lot less cumbersome for them to kind of remember to do. The gold standard with exercises is doing the activity that they want to need to do, as we talked about before. It is not exercises. It is doing the activity. That is what OTs do. That's why we're called occupational therapists, occupation activity. Second best thing is doing a meaningful activity that's similar, that addresses those components. And then third down on the list, those two are just not working, or maybe to kind of supplement the other two. Think of an exercise that addresses those underlying components of the activity that they want to do. So again, the focus is on the activity. You're just trying to build up those components so they can do that activity. Pain-free exercise, slow to keep it pain-free, slow and controlled. Start slow and gradually increase resistance reps. A little stiffness the next day is okay. Joint nerve pain is not, especially if it lasts, and if it's a strong pain, A couple hours post-exercise is not a good sign. Exercises should never increase their pain. Always think good posture. We'll talk more about that as you get into the program, but good posture, good form. Don't want them bending over. Spinal flexion, she's decent in her position here, but she's kind of curving a little bit forward with her spine. Nice straight spine as they're doing it, as they're doing the exercises. Really increases the stress, the impact on their body, on their back especially. Some exercise compliance tips. Start not for very many exercises. 3 or more. I would even start with just one, especially if they're already getting other exercises. Now with home exercise programs, you can give them videos, plus a paper version. People do better with the video than paper versions. Again, research. HEP is home exercise program. Patients are more compliant when they buy into the exercises, educating them why you're doing it. The diagnosis, but don't just give it to them, show them why, what's the point of this. The more personalized it is, individual instruction, the more people are likely to be compliant. This isn't an exercise we give everybody. I'm giving you this particular exercise to work on these particular muscles and joints because this is going to help you get back to doing, the gardening that you love to do. You love to do gardening, so this is going to really help you do those things that are important to you. Feedback. Can you show progress? We talked about showing progress with manual muscle testing, goniometry. Wow, you're getting 30 degrees of range of motion in your shoulder. Your manual muscle test went from 3 to 4. You are gaining. These exercises are working, that sort of thing. Again, part of their daily routine can make them a lot more compliant. We think of the story example with Rick. I don't think there's a lot of detail around that, but he had rotator cuff issues from the trauma from the bombing. It landed on his shoulder. It was never the same. Tears and irritation within those rotator cuff muscles. I won't get into the particulars of the rotator cuff muscles because it's just kind of beyond you right now. Especially shoulder rotation, internal and external rotation. When would you start resistive exercises? How many reps would you start with? How do you know if it's the correct amount? How do you know when to increase? So I would start first without resistive exercises. I would start at gravity-reduced plane, just doing range of motion, probably even just passive range of motion, and then active assisted range of motion, and then can he do it on his own? And then I would start manipulating gravity. Can you go up against gravity? And then once he can master full range of motion against gravity, then I would start to think of resistance, TheraBand, weights, activities that are going to require resistance, that sort of thing. How would I know if it's the correct amount? Is he compensating? Is it too taxing? What is he showing me, with his body when I ask him, that sort of thing? When to increase the resistance. When he's mastered it, he has great form for the full 10 reps. As he improves, what activities around the house should get easier for him. Think of rotational activities. Let's say raking is rotational activity, reaching back to grab his wallet, hook his belt through the loops, things like that require internal, external rotation. So that's kind of an example. Other kind of concepts. Sometimes pain is okay. It's kind of know the diagnosis, what's going on, why you're doing what you're doing. For example, adhesive capsulitis, once it starts to thaw out like a frozen shoulder, there's going to be a lot of pain, and the patient needs to work through that to get their shoulder back. Know your anatomy. You need to know your anatomy. A lot of stuff goes back to anatomy. Kind of think stretching into the opposite movement. What do I mean by that? Let's say I'm working on the wrist flexors. As I flex my wrists, they are on the palm side of my hand, all those wrist flexors. I want to stretch those out. How do I stretch those out? I go the opposite. I extend my wrist. If you extend your wrist, if you do this with me, as I extend my wrist, I can feel those flexors stretching right out. Others examples, we just talked about internal, external rotation. Let's say it's internal rotation. So internally rotate your shoulder. We know the subscapularis does that motion. I want to stretch that out. I'm not going to do internal rotation to stretch it out, maybe to strengthen it. To stretch, I'm going to do external rotation. Go the other way and feel it pulling and stretching out my subscapularis. Passive stretch, we talked about that, kind of works early in the healing, recovery stages. Active stretch, we'll get into these later. What's an active stretch? Kind of the therapist and the patient working together. Usually best when they're fully healed. It's more of an aggressive kind of stretch. She is definitely stretching herself right out there. I would say that's an active stretch. She probably kicked her leg up, and then I have never had that range of motion, even I think when I was 4 years old. Okay, great amount of force when you're stretching. Think of it like a low, steady pressure and get as proximal to the joint as best you can, generally speaking. Um, you, body responds best to stretching when you're moving other body parts, kind of like as you're doing activities and movements. You're stabilizing proximally, applying pressure distally. Consider the lever arm, again, not going too far out. We'll get into that more later on. Facilitate with modalities, manual work. Stretching is more effective after exercise. People think, oh, I want to stretch and then I'm going to go run. It actually doesn't do anything for you. Warm up your muscles maybe by walking before you run, but don't stretch before you run or exercise. Doesn't really do anything, research shows. Stretch after you exercise. You're all loosened up and you can really get some good stretch. Obviously consider the age, the size of the client as you're doing the stretches. Okay, an activity, last thing here. For each one of these muscles, what permanent motion does each muscle facilitate? How would you stretch it? How would you strengthen it with an activity? Okay, the rhomboids. What do the rhomboids do? They give us great posture. They retract our scapula, pull our shoulder blades together. How would you stretch that muscle? I would go the other way. So you kind of protract your scapula, it will stretch out your rhomboids. How would I strengthen it with an activity? Think of an activity that works your rhomboids. I could think of rowing in a boat would be a good activity. Infraspinatus, that externally rotates the shoulder. Good activity to strengthen it. So think about when you're throwing a baseball. When I was throwing a baseball with that client as he was recovering from his slap lesion, we'll get into that later, his shoulder problem, he would come back with his hand, you come back with your hand, that big overhead motion, and you throw it back, and you throw it. Same with like tennis, when you're reaching way back to hit the ball as you serve with tennis. So throwing a baseball would be a great activity. Subscapularis, similar kind of stuff, only it's internal rotation. You could do throwing a baseball again, but really emphasize the follow through. As you come through with that follow through, you're internally rotating. Biceps, flexing your elbow, a big drink, jug of milk, bringing that towards your mouth. Triceps, punching out to the ceiling. He's kind of working his triceps there a little bit. Think of punching a punching bag. You'd work your triceps. Pectoralis major. Think of bench pressing. So pushing, a big push. I would think as you're pushing open a door, you're really working your pec major. That would be an activity to work on that. Okay, that's the end.